Take 2. Hey everybody, it is Jason, and oh, you can't even see the Christmas lights. Oh, very briefly, let's sort that out. Yeah, they're really tiny in this room. Hey everybody, it's Jason. Okay, I think I've sorted out the camera angle now. This is the second take because this should have come out like 2 weeks ago, because I filmed it 2 weeks ago and then I lost the footage because just SD cards, blah. But anyway, yes, so I'm going to be doing today a report, if you like, on my consultation that took place on November the 22nd, which seems like ages ago because it's now December and Christmas and things and chimichangas. Yeah, it was very good. So, for those of you who have no idea what I'm doing with my surgery, so I chose to go private, and I've gone private with Mr Kneeshaw. If you want to hear more about why I decided to go private, then head on up there. There is an extra video there. But yeah, basically, it was a long drive because, you know, from where we are, it is a few hours. But when we got there, yeah, it was pretty damn efficient. In fact, we got there about 40 minutes early. But I hadn't even, like, they had a fancy coffee machine, so I went to get a coffee, but I hadn't even, like, started drinking it before they were like, okay, Jason Green, come on. So, I was escorted to his room by a nurse, who was very nice and happy and very northern. And he sat me down, we talked about a few things, he wrote a few things down. One of the first things he said, interestingly, was, how old are you? It's like, well, I know I don't look it. We sort of talked about stuff and, okay, yeah, you have genital dysphoria and you are after surgery, yes, obviously. He then talked about the referral thing, going private, because basically I've been told by a few sources and a few people that actually he only needs one person to say yes, fine. So a psychiatrist or what have you. But apparently that's not quite the case. He needs 2 people, just in the same way as an NHS referral. To which I'm like, oh, okay, because obviously if you watch in the video, I've only got 1. But he was really, really nice about it. I wasn't sure if he was going to sort of cut the conversation really short and ask me to come back again after I got my second thing, and that it would delay a date. But he's like, no, it's all good. I'm going to write a letter to Charing Cross if it's okay with you. It's like, in the length of time I normally have to wait for something to happen in transition, obviously that's okay. And he said he was going to write to them and ask them to get somebody else to say yes, okay. And I also mentioned my first psychiatrist who I saw at Charing Cross. And I said, well, with the first person, I sort of talked a bit about my chest, but we didn't talk specifically about surgery, and I didn't really know that you could ask for surgery from the first person. I thought I had to wait until the second for some reason. There's no manual with this. And he's like, okay, fine. But I'll write to your second one, Dr. Crawford, because she obviously was the one who said okay. So that was all sorted, and he said if that doesn't work, so if they don't get back to you, there is also this option. So it was really, really cool in that he gave me these options, which was wonderful. The worst thing you want is just for someone to sort of turn around and say, no, I can't do it, and they're just like, you know, you have to sort it out for yourself. It's like, no, you know, you help. So that was really good. Then we moved on to talking about the actual sort of technique I wanted. So I said, yeah, basically I want double incision. I'm not interested at all in keyhole or periareolar, but also I fear that I was too big for it anyway, because it was really funny because he asked me what size am I. I'm like, I have no idea, I've never been measured. So I said, okay, what, small, medium, large? And I said, well, medium, I suppose. I think that I'm about a C cup because that's what I used to wear, although having said that, lots of people, if they wear bras, wear the wrong size anyway, so I would imagine that I'm about a C cup, a small C, I think. So he sort of took some information down, and then we went into the examination part. So I had to, first of all, lay down on this bed and be checked for lumps. And he was sort of really efficient about it, but also very calm, so he wasn't rushing through everything. And it didn't feel awkward at all, like him sort of feeling everything up. Although I kind of knew it was coming up, so maybe that's why, but I don't know. So he said that, and said, no lumps, okay, fine, which is good, because I do check for lumps, but it's good for him to actually, somebody who knows what he's talking about in that area, to say, yes, you have not got any lumps. Okay, cool. And then we moved on. I had to sort of sit up, and he sort of examined them more in terms of their shape, their aesthetic. He said things like, oh yes, this one hangs slightly lower than the other one, even though they're the same size. It's like, okay, I didn't notice, but cool. And then he talked about the possibility of dog ears. Now, I'm quite a fan of, something as major as that is going to happen. It's like, I want to know if something like dog ears is going to be likely. Like, you might as well say now, because then I'll know. Dog ears, for those of you who don't know, they usually happen here. Apparently they can happen here though, and I didn't know that, but he told me. What it is when there's loose skin, either before surgery or after, when everything sort of heals and the skin starts relaxing, you can get these sort of folds of skin that sort of hang, hence why they're called dog ears, because it's like, hanging. And he said, yeah, it's possible I could get some here during the healing process, but he said also there's a slight possibility of me getting it here. And I'm like, okay. But he said that it's absolutely fine, we can get revision for it. And it's like, yeah, that's fine. I don't mind at all. But as I said in the previous video, I went with Kneeshaw because his nipple placement is amazing, his results are really consistent. So in something like small, like a dog ear, that's fine, doesn't really matter. And again, I can get that done like 6 months. He also talked about potential of nipple loss. He said that he has not once lost a nipple, which is obviously very reassuring, even though it can still happen. So he told me about, why it could happen, the various risks of it, and if it does happen, then you can get sort of reconstruction. He does tattooing as well, which is really good. So again, I've mentally prepared myself for, if that happens, then yeah, okay, I could get like a tattoo or reconstruction or something. So it's all fine. He then proceeds to show me different chests. And he also took a couple of pictures of me. But then he showed me a couple of different slides of different sized chests, but all double incision. And it was really surreal, because the first image he showed, I thought that was my chest, because it looked identical, and it's just, huh? Like the areola was sort of the same size, and, general size. But no, it was a different person. It's like, oh, okay. And the results look really good, so I'm like, okay, this is reassuring. But then also on the sort of the larger chested individuals, again, their results look really good. But interestingly as well, he said about, there were a couple he showed where they were really heavy smokers, and that's a thing that they say that can cause the potential of nipple loss, because if you smoke, then it takes longer, I think, for the cells to heal or something like that, or reconnect, which is what you have to do with a nipple, because obviously if you take it off, you have to reattach it, nerves and stuff have to, reconnect. So even though they were a heavy smoker, their nipples still reattached fine. So again, that was reassuring to me. Not that I'm going to go away and start chain smoking at all, but it's nice to see that. And then he talked through a couple of other risks, like blood clotting and things like that. But again, I'm aware of these things that can happen. And again, it's a surgery, so it's good to know about the potential risks with it, and it's a big deal anyway. And also, there are some people who do or do not react well to the general aesthetic as well. One example which worried me a bit was when Ash got their chest surgery, and I believe it was in the hotel. They threw up a lot, had really bad headaches. So I'm like, okay, but fingers crossed hopefully it'll be fine. I've never had general anaesthetic before, only local, once. So I have no idea how I'm going to be with it, but you know, we'll just have to see. And fortunately I'm in hospital for 2 days afterwards, with drains. Then I have to go home, apparently, and then come back the next week and get them removed, and the staples removed as well. He was very sort of calm about the whole thing. It was very refreshing to have his point of view as opposed to, say, the people at Charing Cross's point of view. Not all of them, but the people who kind of took us through like the details of things like chest surgery and bottom surgery. They were very much about, here are the risks, and la la la, and much more about that. I'm not saying that Kneeshaw didn't talk about them, because again, he did in a lot of detail, but at the same time, it was just the way he talked about them. It's like, he was much more objective about it. Like, okay, yeah, this is a risk, it could happen, it's a surgery. But this is what we do to fix it if it does happen, you know, things like that. So that was really nice, rather than, you know, oh, most people have this surgery because it's the safest, and you know, stuff. Yeah, so next then, that I have to do, I have to go in for a pre-op and second consultation, which will be 21st of February. So when I am, I believe it's 8 months, yeah, 8 months on T. Exactly 8 months on T, which is really cool. So I'm gonna, I think, be weighed and measured and stuff like that, and then also have another consultation with Mr Kneeshaw. And then obviously there's the date of the operation itself, which he set, which was March the 5th. So March the 5th I am having surgery. I'm not quite sure what time. I'm being admitted into the hospital at about 5 in the morning, 5:30 in the morning. I think the surgery is going to be about 9 o'clock-ish. He did mention 9 o'clock for something. So I was like, okay. So we're up nice and early, but then at the same time I kind of prefer that, because it means that, because I'm fasting with food and stuff, I'm not having to wait all the way until like the evening, for example. So that's really, really cool. And then in the meantime, I'm just waiting now for this letter to come back from Charing Cross. They have confirmed that they have received it, which is good, and the guy on the phone kept saying that, oh yeah, Vanessa's really, really quick with letters, and I'm like, I know. So like, give her a week. Okay. So that should come in a week, I would imagine. But yeah, overall, as I said, it was really, really good. The drive was long, unfortunately, but it's one of those things, and it's going to be worth it. And I'm going to have pillows and stuff to prepare when it actually does come to the surgery and stuff like that. And ever since doing this consultation, I've been feeling so much better about my chest and not feeling so self-conscious of it. I'm trying not to wear my binder too much either. Like, I'm really sort of doing some self-care, like with my back and stuff. Like, I mean, my back's hurting now, but I'll take this off. It's kind of weird. It's like, I don't care if someone sees them, because they're going to be gone in 3 months. And in fact, the time of recording this, it is exactly 3 months away now, the surgery. So, but in the meantime, thank you very much for watching. Feel free to hit like and subscribe if you want to see more updates on my transition and so on. And I will see you guys, I'm not sure why I'm doing this, in the next video. Bye-bye.